Okay, so this is the skeletal system, which is slides number 15. And it's basically skeletal system means the system that involve the skeleton, which are the different bones of the body, plus what's related to the bones, like what's connecting the bones to each other, how the bones like articulate or make joints together. And this is basically the chapter, which we're talking about joints and ligaments. We will discuss it. Generally speaking, the bone is actually connective tissue. And this connective tissue, if you remember, we did the tissues before. Connective tissue can be soft, can be rigid, can be hard. This is hard. Why? Because it contains calcium. Calcium is what make the bone hard. Remember, I'm going to focus on the most important thing. So if I focus on something, if I say something, it is important. It is part of the learning objectives. Um, okay, so what exactly is the bone? Two things: bone cells plus non-living matrix. Cells in matrix. What's a matrix? The matrix is the actual component in which the cells are located, and it is collagen, calcium, phosphorus, and magnesium. We always remodel the bone. Remodeling means breakdown, reform, breakdown, reform. You will learn uh, the details. Here is something important to know, that look at this bone. This is the femur. And usually the bone is covered outside, the most or the outermost layer, which is this one here. It's like peeled off. Not this one right here. And this is called periosteum. What's periosteum? Peri, a prefix that means around or surrounding. Osteum means bone. So this is the surrounding of the bone or around the bone. The innermost, there is one inside. So there are two covers. One is outside and one is inside. The innermost is called endoosteum. Not this one. The innermost is inside here. It's called the endoosteum. And the cells. So far, what is the bone? Hard connective tissue. Why is it hard? Calcium. What's the bone? Cells plus matrix. Cells. We have osteoblasts, osteoclasts, and osteocytes. There is osteo before every one of those. Osteo means bone. Osteoblasts, the bone builders. Osteoclasts, the bone breakers. Osteocytes, these are the mature cells, so they maintain. Cyte and blast, both of them means cells. But the difference is blast is the immature cells. So these are the ones that build. When they become mature, we call it cyte, osteocyte. And their function now is maintenance. So it's the same one. Blast, immature to build. They grow up, maturate, and become osteocytes for maintenance. So here are the different types of cells: osteocytes, maintenance, mature cells; osteoblast, builders, immature cells; osteoclast, this is not even a bone cell, but it's called osteo, and osteo means bone. Yes, these are the bone breakers. They are not even bone cells. They come from white blood cells. If you guys still remember, we talked about this before, that there are some eaters. These eaters go to the bone and become part of the bone, and we call it osteoclast, the bone breakers. Why do you want to break down the bone? It's not really breaking down. It's just you dissolve it. You dissolve part of the bone for whatever reason. Either you are remodeling, like you're changing the shape, the size, like growing children or something, or You wanted to dissolve part of the bone to get the calcium out of it. In both cases, you're going to dissolve the bone anyway, not the whole bone, part of the bone. And this is osteoclast. The last one is osteogenic cells. Remember, you see osteo in all of them. Osteo is a prefix that means bone. Genic means generation. These are the stem cells. So these are the 4 cells that we need to know. This is very important here. The cells are important, and this part is very important because these are basics. We have 2 types of bone. One of them is called compact bone. Compact means condensed, hard. These are the dense ones, and the building unit here is called the osteo. And you need to remember these because this is very important. Compact bone, which is the cortical bone. What cortical means? Cortex. Cortex is cover, the outside. Look at this picture here. Look at this outside here. This is compact bone. Now look at the inside, the one that contains cavities here. This is the other type that's called spongy bone. The name gave it away. Compact is actually compact. It is compressed. It's hard, something like wood. While the inside is called spongy because actually it looks like the sponge. There are cavities in there. And the building unit is called trabeculae. Trabeculae. This is very important. Trabeculae. So what's the building unit of the compact or cortical bone? Osteon. What's the osteon? This. Look at this circle here. Like these, layer after layer after layer after layer, and there is a cavity in or a canal in the middle. This is called osteon. While this, look at this here, like this and this, and there are spaces in between. These are called the trabeculae, the building unit of the spongy bone. Very important to remember. And this is the inside. Compact bone is outside. The other thing that I want you to know is where we always hear about the bone marrow. Well, this is where we make red blood or blood cells in general. We make it in the bone marrow. Where is it? Where is the bone marrow? Here in the spongy bone, not in outside, in the spongy bone. And something else that I want you to know is when we're born, when we are child, when we are growing, this bone marrow here, the bone marrow is red in color. Red means active. It's working. It's making the blood cells. As we grow, we are going to, like in the beginning, we need a lot of these cells. But later on, we are going to store fats in this bone marrow. And instead of being red, it will become yellow. Yellow means not active. So if you're a child, everything will be red. As you grow, it's part of it will be yellow, more and more and more, and so on. So it will be occupied by the fat because you will need less cells later. Okay, look at this picture right here. I told you guys I'm going to be focusing on the core of the chip. So look at this. Look at this, how it looks like actual sponge with all these cavities. But look at these, like these struts, or these like looks like these bone with cavities here. This is called trabeculae. So the inside here, all of this is spongy bone, and these are the trabeculae, the building unit, while the outside is the compact or the cortical bone. And we don't see it here, but if you like get a magnifying glass or look under the microscope, you will see the osteons. Look at this picture here. Look at all these osteons or the Haversian system. Look at this, like this, circle after circle after circle. Looks like you're cutting an onion. This is how it actually looks like. Looks like you get an onion and you cut it in the middle, and you look at all of these circle after circle after circle. But in the middle, there is a canal in the middle in which the blood vessels are located.
Should we
But
memorize this photo?
not that's too much. I will tell you what should you memorize. But for now, I
Okay.
just wanted to show you how it looks like.
All right, thank you.
You're welcome. Just for your understanding. And look at this outside. This is the outside here, which is the periosteum. And then look at this. This is the compact bone. And look at the inside here, spongy bone. And these are the trabeculae. These are the osteons. Same thing here, just showing you inner picture, but what I told you is enough. The outside is periosteum. This is compact bone with the osteons. In the middle, there is a canal that contains the blood vessels, and this is inside here. This is the spongy bone with these trabeculae. This is just a picture showing you how the osteon looks like from inside, layer after layer after layer. That's it. I just want you to understand how it looks like. And in the middle, the canal here contain the blood vessels and a nerve. Good enough to know. Now, if you look at one of these long bones, you will see a shaft and two ends. Like all these bones look like this, all these long bones. There are different types of bone, I will talk about it. But for now, there's always a shaft in the middle and two ends. The ends are called epiphyses. Epi means end, epiphysis. So look at this picture right here. This is the epiphysis of the femur, one of the bones. And this is the epiphysis of the other bone, which is the tibia. And if you look here, there is a line here, a plate. It's called the epiphyseal plate. This epiphyseal plate is important because it is active until the age of something like around 28. As long as this plate, we also call it cartilage, as long as it is still active, you are growing taller and taller. Your height is increasing. Your bone length is increasing. At certain time, it's different from person to person, but let's say late, uh, like 20s, 20 something, 25, 24, whatever. Everybody's different, but they are going to be this plate or cartilage like this and like this. It's in all the epiphysis. And remember, epiphysis is the end of the long bones. This will be closed and it will become bone. It will look like this. So now that's it. You reach your maximum height and your bone are not going to grow anymore. So what was the cause for us to grow, or what was the cause, or what was responsible for our long bones to become longer and our height increase? Epiphyseal plates in the epiphysis. And what was helping that is the growth hormone. Remodeling, nothing much. The only thing that I want you is it means turnover. Turnover. You break this and you build out. You break this and build out. And this is how you make a small bone bigger. The other thing that I want you to know is, I told you already that the cells are osteoblast, which will become osteocyte, osteoblast, bone builders, immature. The same osteoblast, when they grow, maturate, they become osteocytes. Now they only maintain. Like if you are young, you build your own house. And when you grow, now you're mature, you're old, you don't need to build anymore. You're just going to maintain your house. Same you. You build your house, you maintain your house when you become mature. Same thing here. Osteoblast, immature cells, young cells, they build the bone. When you maturate, same ones. They become osteocytes. Now they are just maintaining. So what do you mean by building the bone? Building the bone means, remember I told you the bones, cells, and matrix. And matrix is collagen, calcium, and others like phosphorus and magnesium. So when we say building the bone, it means you put collagen and you put calcium and other minerals in it. You add calcium to it. This is building. Breaking down, which is osteoclast, break, clast. This is how I remember it. Break, clast, the osteoclast. What do you mean break it? They dissolve it, taking calcium out of it. Now it will become weak. Does that happen to us? It can. Here is how. If I am exercising, my bone becomes stronger. How? Osteoblast will take the upper hand. There is always a balance between the bone builders, osteoblast, and the bone breakers, osteoclast. There is a balance. As long as you're doing the normal activities, they are balanced. None of them is taking the upper hand. You stay as is. But if I am exercising, your osteoblast will take the upper hand. Your osteoblast will say, okay, it looks like we need to be stronger to be able to exercise. So I'm going to take the upper hand above the osteoclast. So what are you going to do? I'm going to take calcium and put it in the bone so that the bone grow and become thicker, stronger. The opposite is if you're not even doing the normal activities, like you're laying down in a bed, like if somebody's having like a chronic illness and laying down all the time, now the opposite will occur. The osteoclast will take the upper hand. To them, of course, they like these cells, they don't think. All what they do is, are you using the bone or not? I'm using the bone, just a normal, we will keep the balance. I'm exercising using the bone more. You need stronger bone. Okay, I will make the bone stronger. Osteoblast, adding calcium. You're not using your bone, not even the normal activities. Okay, I will. The osteoclast will assume that you don't need it. So why don't we dissolve the bone, take the calcium, use it somewhere else instead of just leaving it in the bone that you're not using? You get the idea? This is how it works. So uh, normally, again, there is a balance between those. But the point is, why would you ever dissolve the bone and take the calcium out of it? Because you need the calcium more importantly in your blood. Normal blood calcium is extremely important, even more important than the calcium being in the bone, because one of the functions of the bone is not only like to carry you and to give attachment to the muscles and to protect you and all that known stuff for the bones. No, one of the calcium is storage. They store the one of the functions of the skeleton or the bones is to store calcium. Where else do we need the calcium that's extremely important like that? Yes. Number one, nervous system. Believe it or not, your nervous system doesn't work without calcium. Number two, your muscles. Your muscles will not work without calcium. Believe it or not. To the extent of if you have very low calcium, your muscles will stop contracting. Even your heart can stop. It is that bad. So we have to make sure that we always have enough calcium. You're eating, so normally you have enough calcium, but just in case if something happened, we can take from the bone through the osteoclast and send that calcium to the blood. There is another thing, it's also needed for blood clots, but the most important is nervous system muscle contraction. You don't have enough calcium in the blood, nervous system will not work, muscles will not contract. Simple. In order to make all what I talked about so far, remember again, to be on track with me, the bone is cells and matrix. What's the matrix? Collagen and minerals, including calcium. In order for those to function, you need certain vitamins. You don't have to know the details, just know that we need that we need vitamin A, C, and D. And I think we all know vitamin D. I don't think any one of us didn't hear about, even in the TV or something. Vitamin D. They tell you if you don't get vitamin D, your bone will become weak. And I think we know rickets in children. If they don't have enough vitamin D, their bone is weak, and the bone start to like start bowing and start to curve and so on. ACD, and we also need some K and B12. If you understand that, that's good enough to know. We need these vitamins. Normally, look at this picture right here. This is how the bone should look like. But if you don't have enough calcium in your bone will become weak. And weak is a generic word. What do you mean by weak? Weak can be, in children, we call it rickets. Vitamin D deficiency, and vitamin D is needed to absorb calcium, simply. You don't have vitamin D, you don't absorb calcium, your bone is weak. Simple. So if you are a child and you don't have enough vitamin D, you will not absorb calcium and you get rickets. In old people, more in females than males. It doesn't mean that males don't get it. It's more in females. And here is the issue. It's a completely different issue. In children, it's vitamin D that help absorption of calcium. That's why their bone is weak. This is completely different than if you are growing older, especially in old ladies, your bone will become weak, but this is a completely different scenario. Here is because specifically after menopause. After menopause, we all know that ladies, their hormone estrogen drops. And we talked about that before. The estrogen drops. The estrogen was stimulating the bone builders, because when you are a young adult or like you still need your physical activities and you're working, your hormones will stimulate the bone builders to make sure that your bone is strong enough. After menopause, not just the eggs are gone, no, the estrogen drops. By the way, in males, also testosterone drops. And testosterone is doing the same job as estrogen. So if that's the case, look how the bone will look like. We call this osteoporosis. Look how the bone is like porous, contain a lot of pores compared to this. Look at this versus this. This is called osteoporosis, and this is due to hormones drop, the reproductive hormones, the sex hormones, estrogen in females, testosterone in males. Look how it looks like. Because of the fact that sex hormones were stimulating the bone builders. Okay, so here it is: estrogen and testosterone, both of them. They stimulate our bone builders so that our bone is strong until these hormones start to drop after menopause. In males, there is something that's kind of similar to menopause. We don't talk much about it because it's not as strong as menopause, but it's called andropause. Anyway, when these hormones drop, the bone become weak. One more thing here, there is a hormone that's called parathyroid hormone. This hormone is responsible for increasing calcium. The opposite is called calcitonin, another hormone called calcitonin. It drops calcium. Parathyroid hormone increase calcium. Calcitonin decrease calcium. So which one? Balance. You have a balance between those. If the calcium goes up, calcitonin will drop it. If the calcium goes down, parathyroid will increase it. The bottom line is we need calcium in the normal range. We don't want it too much. We don't want it too low. Not too high, not too low. So you have a balance between those two, parathyroid and calcitonin. The other one is calcitriol, which is coming from vitamin D. Here it is again, osteoporosis. By the way, as usual, always do this. Look, osteoporosis. Osteo, I mentioned it several times. It's a prefix that means bone. Porosis is coming from porous. Porous means contain a lot of pores, like cavities, spaces. And this is what happened here is after menopause specifically. If you ever heard of this, like your old mom or your grandma or something, she fell just a little fall, not like something huge, but her pelvic bone is broken. How? Osteoporosis. It doesn't take even uh, the minor or the minimal mechanical hit or vigorous movements. By nature, we need to know also that at the age of 40, our bone strength start to decline. Start. Here it is again. This is normal, but this is a close picture. Look how porous this is. Look at all these pores that we don't have it here. Osteoporosis, usually after menopause, it is hormonal. Here is a normal one. Look at the compact bone cover. Same here, compact bone cover. Look at the inside, sponge. Okay. In aging, the bone will start to become weaker. Hormones is one of the things. Um, and there are some changes that if you ever heard of this, like we maintain our height until certain age, like 70s or something, and then you hear like we are getting a little bit shorter. It's not very accurate. You're not getting shorter. It's just the bone is being compressed. What should we do to avoid losing our bone? Well, you already know that no matter what happened, your bone, when you grow up and become older, no matter what, the bone is not as strong. So, uh, like you have to be more careful not to fall, not to hit something, and so on. Training, remember training. What's the training? Again, I mentioned it before. Exercise, even mild exercise, stimulate the bone builders. So kind of keep your bone strong. If you need calcium or vitamin D, you can take it. Carbonated drinks. This one disturb calcium absorption. Exercise is important. Is the bone epithelial or connective tissue? I told you it is connective tissue already. Consists of living cells and non-living what? Matrix. I mentioned it. Why is it hard? Calcium, the mineral called calcium. Which part of the bone, which type of bone is dense? Compact or cortical bone? Which one is sponge-like, spongy bone or trabecular bone? What's the building unit here? Osteome. This circular structures. What's the building unit here? Trabeculae. This process, the bone is growing and repairing and so on. This is called remodeling. Bone remodeling is important for what? For homeostasis. Homeostasis of what? Of calcium and minerals. Remember, I told you it's extremely important to have normal calcium level. And when you keep it, this is homeostasis. When you keep it within the range, because if it goes up, that's bad. Your muscles can stop working, or it can like contract and doesn't relax. If you don't have enough calcium, your muscles will not contract in the first place, including the heart. The heart can stop. So you have to keep it in the normal range. From the very beginning of this course, I told you this is the goal actually. Within the normal range, homeostasis. Within the keeping everything within the normal function and the normal range. Homeostasis. We've been talking about homeostasis from the beginning until the end. Homeostasis, homeostasis. Because you need to, why homeostasis? Because balance of calcium. You need normal calcium level in the blood. Again, calcium is extremely important. You have to have enough in the blood because it's important for what? Nervous system and muscles. These are the different functions of the bones that you have to know. These are basics. And you can think about it. Support. What if you don't have bone? You will not have the support. You will collapse. Your muscles will not find an attachment. You will not have protection. Give me examples. Yes, I can give you examples. Look at your chest. There is bone here, like this bone here, and the bones in the side, the chest bones. This is protecting the lung and the heart inside and other things. Protection. Movement. It provides attachment to the skeletal muscles. You have to have bone for attachment. Homeostasis. Remember the storage. You store minerals like calcium and phosphorus. Blood cells. It's called hematopoiesis. Remember the bone marrow inside the bone, so it does count. So the functions of the bone. It's housing the bone marrow, and because of housing the bone marrow, this is how we make blood cells. So blood cells production. Energy storage, remember I told you, red bone marrow is the active bone marrow when we are children or young adults. Later on, it become yellow because you store fat, and fat is energy source. Now, the different types of bones, the most important one is the long bone that I talked about, like this one here. Look, this from here to here, shaft. We also call it diaphysis. Look at the ends, epiphysis, epiphysis. Remember the epiphyseal plate right here. The bones can be also flat, can be short, like the bones of your wrist, tiny bones, you call it short, and it can be irregular, like your vertebrae, like the vertebral column. Irregular means it doesn't look like anything. This is kind of too much to know, the numbers. Okay, this is something interesting that when we are babies, we have more bones in the number, not the size, number. Why? Because the bones are going to fuse to each other later. Like the skull bones, the skull in the baby and in the fetus as well, is a lot of bones, but they fuse together when they are born, and as we grow, they become like bigger bones. So I'm talking about counting only. So yes, babies have more bones than adults because later on, these bones are going to fuse together. And instead of having many tiny bones, they have one big bones. So is the bone size decreasing? Actually, no, it's the opposite. The number is decreasing. Here it is again. This is the femur, one of the bones, diaphysis or shaft, epiphysis, one end here, one end here. Outside is compact, inside is sponge, and the bone marrow, the bone cavity contain the bone marrow red, and it will become yellow later on. Okay, now this part is important. The bone is divided into bones around the axis of the body, like here, this is the axis, like the middle line, and we call those axial skeleton, like the skull. Look here, skull. The vertebral column, and the ribs. This is all like in the center of the body, around the axis. So we call that axial skeleton, around the axis. And then your upper limb is attached to that axis through the shoulder. We say it's appended to the axial skeleton. Your lower limb is also same thing. it's appended or attached to the axial skeleton through your pelvis or pelvic uh, joint. So we call this part appendicular skeleton. Axial skeleton, appendicular skeleton. Remember, we're doing the skeletal system, which is the bones, but you need to know that we have ligaments attached to the bone. Why? Ligament attach bone to bone. Bone to bone, like this. Look at this. Like this. Bone to bone. Look at this. Bone to bone. Ligament. Tendon, on the other hand, look at this muscle. The tendon attach muscle to bone. You do need to know this. Ligament, bone to bone. Tendon, muscle to bone. Now, we are going to see these, but in this part, you need to know the individual bones, okay? So you will see some pictures because I want you to know like this. This is called the scapula. This is called the humerus, ulna, radius, rest bones, phalanges, vertebral column, ribs, pelvic bone or hip, femur, tibia, fibula, tarsal or ankle bones, phalanges. Okay? You do need to know those, not in full details, but you need to know the basics, and I will show you again. There are other pictures that I'm going to show you. But when you go to the next class, I'm going to tell you now that this is not enough. Like this is the scapula. Yes. In the scapula, you will have like 5, 6, 7 different things that you need to know in details. But for now, this whole entire bone, what do you call it? This is something that you have to know. And let me just give you a hint here. This is called the scapula, which is part of the shoulder, attaching your upper limb, all these bones, to the axial skeleton here. And this is called the humerus. Those two bones, how to know them from each other? One of them is called ulna and one of them is called radius. Listen to this. So you can label it. If you have this question in the exam, you will be asked because you have to know at least the minimum is the name of the whole entire bone. Look at this. This is your thumb. Your forearm is 2 bones, not just one. Like your arm here is just 1 bone. No confusion. What is the bone inside this arm? Humerus. What are the 2 bones inside here? It's 2, not 1. So you need to know them from each other. Look at your thumb. The one bone that's toward your thumb is called radius. The one toward your little finger is called ulna. This is how to know them from each other. And you do need to know this. The bones in the skeletal system are axial and appendicular. What's the axial? Here, axis. Skull, vertebral column, ribs. Appendicular, appendage. Upper limb with the shoulder, lower limb with the pelvis. Ligaments attach what to what? Ligaments, bone to bone. Tendons, muscle to bone. Why do we need the bones? We talked about it. Support, protection, movement, attachment, storage, energy. Very important. I told you before. Red and yellow bone marrow, I told you. Red is the active that make the blood cells. Yellow is inactive because the fat is inside. Now look at this picture. The orange is the appendicular skeleton, skull, chest cage, like ribs. It's not just the ribs. There is also sternum here. This bone in the front here. In the middle, front chest. In the middle of the front of your chest. It's called sternum. And the vertebral column, which is this. Look at this. Or it's a lot of vertebrae. All of these. Like you have 12 I mean 7, 12, 5, and 1 right here. 1, 1. 7, 5. I'm sorry, 7, 12, 5, 1, 1. These are the numbers. Versus the green. The green is what's attached to the axial skeleton. One more time. What's the axial skeleton? Skull, vertebral column, this, and chest cage. What's the chest cage? Ribs plus sternum. How about the appendicular skeleton? Upper limb attached through the shoulder, which is basically the shoulder is this bone scapula, and one in the front here, it's right here. You can feel it in the front. The collarbone, it's called clavicle. So what's attaching the upper limb to the axial skeleton? Scapula in the back and clavicle in the front. And then the upper limb, humerus, ulnar radius, carpal bone or wrist, phalanges. How about the lower limb? The hip bone or the coxa, hip bones, femur, tibia, fibula. How to know them from each other? The tibia is the big one, toward your big toe. The fibula is the tiny one. It's not shorter, it's just thinner. And this is towards your little phalanges. If you look closer at the skull, you will see all these bones, but this is kind of too much for now. Just know that all of these flat bones right here, these are called cranial bones, and this in the face are called the facial bones. There are some cavities inside the bones. We call it the sinuses. I think we all heard about somebody having sinusitis, infection or inflammation of the sinuses. What are the sinuses? These cavities inside your bone. Why do we have cavities inside the bone? So the bone is not really like compact, like it's not all full. No, there are cavities inside. Sinuses. Why do we have these cavities? Different reasons, but the most important of all is to make the weight of the skull lighter, so you're not carrying heavy weight. And also it provides resonance to the sound. The normal sound that we hear, which is resonant, it's because of these cavities inside, like here in this frontal bone, in the maxilla here, inside. We have these cavities, resonance, and to make the weight lighter. There are other functions, but these are the most important ones that I want you to know, okay? And sinusitis means any one of these, like here, frontal, maxillary, ethmoid. You don't have to know the details, just understand what are the sinuses. That's good enough. Sinuses, cavities in the skull bones. Why? Make it lighter and resonate the sound. And that explain if somebody's having sinusitis, you can tell once they start talking. Here are the other bones, but I should say that this is too much. You will learn it in the next class. I just want you to know the skull is two parts. Cranial, which are these flat bones, and facial in the face. Enough. The vertebral column, you have 7 cervical bones. Cervix means neck. 12 thoracic, 5 lumbar, 1 sacral, but understand that this sacral used to be 5, they fused, and 1 coccyx. Can you help us remember this? Yes. Remember, you get your breakfast at 7 a.m. That should remind you the first one, 7 cervical. What's a cervical? Cervix is neck. You get your lunch at noon, 12 thoracic. You get your dinner at 5 p.m., 5 lumbar, and then 1, 1. Enough. This is called the sternum. That's it. Just the whole bone, not the details. What is this whole bone here? Sternum. What are these? Ribs. 12 and 12. It's 20, it's 12 pair or 24 total. All these ribs. So the axial skeleton is around the axis, the vertical axis, which is what? Skull, vertebral column, and chest cage, the chest bones. What are the chest bones? Sternum in the front middle, and 12 ribs right, 12 ribs left. How about the appendicular skeleton? It's appended to it, outside. You should also know that, look at this, like all these vertebrae, you have 7, 12, 5, 1, 1. In between each two of those, there is a disc. It's called intervertebral disc. I think we heard about somebody like having a hernia, herniated disc, or disc prolapse. It's this disc, if it move out, it's called herniated disc or disc prolapse. Appendicular skeleton are these bones, and look at them individually because you have to know the whole entire bone. No details, but you have to know the bone. Sternum, clavicle, scapula, humerus, radius, ulna, carpal bones, metacarpal bones, phalangeal bones. Do I need to know this? Yes. This is the minimum. You have to know it. All these names. And the only thing that most likely you might be confused is which is the ulna and which is the radius. Okay? Again, the radius is toward your thumb. The ulna is toward your little finger. Remember that. Okay? Radius toward your thumb. Ulna toward your little finger. Carpal, wrist, bones. You have 8 bones inside this, inside your wrist. And then these bones here are called metacarpals, and these are the phalangeal bones. How about the lower limb? This bone here is the hip bone called the ilium. This big long bone here in your thigh is called the femur. And then tibia and fibula. How to know them from, this is the only thing most likely the one that can be confusing. The tibia is the big one towards your big toe. The fibula is the small one towards your little finger. Males and females pelvis is different. The only thing that I want you to know here is this angle. Okay, the angle is wider in females so that the baby or the fetus can leave, the baby can be delivered through this wide, while in males, there is no delivery, there is no pregnancy or delivery, no need to be wide. That's enough. So the appendicular bones are upper limb, lower limb. Lower limb is attached by pelvic girdle or pectoral girdle, which are the pelvic bone. Hip is the most important one. The thigh bone is called femur, the big bone in your thigh. Wrists and hand and ankle and feet correspond to metatarsal, antarsal, metacarpal, and carpal. Okay, let me show you here again. Remember, scapula and in the front clavicle, humerus, radius, ulna. These are the carpal bones. Metacarpal bones, phalangeal bones. How about the lower limb? This pelvic girdle, but this bone specifically is called the hip or the coxa. You should remember both of those. And then what? The thigh bone is the femur. The leg bone, it's two. The one that's more inside toward your big toe is the tibia, and the outside, the thinner one is called the fibula. And then what? And then the same as we said in the upper limb, you have the ankle bone that's called tarsal. After that, you have metatarsal and then phalangeal. So here, carpal, metacarpal, phalangeal. Tarsal, metatarsal, phalangeal. Now, the long bone specifically, and let me tell you this. In order to say any of your bones is a long bone, not like flat or short or something, it doesn't literally means it's actually long. So long is not referring to the actual length. No, the long bone is a description of a bone that have a shaft and two ends. That's it. Any bone that have a shaft and two ends, we call it a long bone. So this humerus, is it a long bone? Yes, you have a shaft and two ends. How about these? Ulna and radius. Long bone? Yes, you have a shaft and two ends. Now look at this surprise. Look at this bone right here. If I told you this is a long bone, you will say, no, it's not a long bone. No, this is not a measurement. There is a shaft here and one end here and one end here. It is a long bone. So long bone is a description, not measurement. The term long bone is a description, not a measurement. So if you go to these long bones like here, look at this. This is the femur. It make a joint with this tibia. Any joint like this, humerus with the ulna and radius. Look at this. Humerus with the scapula. Any joint in the long bone is called synovial joint. Synovial joint. And this is the one that allow movement. And this is the vast majority. Any long bones. Any end of any long bone, the joint of which is called what? Synovial joint. Why did you call it synovial joint? Because there is fluid in there to lubricate and allow the movement that's called synovial fluid. Sometimes there is a cartilage in between the bones. We call that cartilaginous because there is cartilage in between the ends of the bones, and this will allow slight movement. Sometimes there is fibrous tissue connecting the bones, no movement. So some joints will have movement, allow free movement, like all synovial joints, all long bones. Some other joints, like here is one bone and here is one bone, they come together and there is cartilage in between. This is slight movement. The example of this is, let me show you something here. Like let's say this one first. This is a synovial joint. End of one long bone and end of the other long bone. There is cartilage covering the end, cartilage covering the other end. There is fluid in between and a bunch of ligaments and capsule. We call that synovial joint between the ends of the long bones. Look at this on the other hand. This bone end with cartilage, and this is another bone. So if there is cartilage in between the bones, same as this, cartilage in between the bones, we call that cartilaginous joint, slight movement. The last one is fibrous. Look at this, like, can you move the bones of your own skull as an adult? Can you, like, if I do this, is the bone moving? No, it's not moving. I know in newborn, it is movable, but I'm not talking about this. Because in the newborn and babies, this joint here in between, here is one bone and here is another bone. When these bones come together, there is no fibrous tissue yet. So it can be moving. Of course, don't do that. But if you hold a newborn and try to push a little bit on these bones, they will actually move. But this is not the rule. I'm talking about adult now. Newborn is an exception. So in us, adults, or even children, not the newborn, these, here is one bone, here is another bone, in between fibrous tissue, connect them. Once the fibrous tissue connect them, it's not movable anymore. Fibrous joints. Look at this. This is a newborn, a baby skull. Look at this. This suture here, which is between this one bone in the right, blue, and this one bone on the left. So this is not fibrous tissue yet. So if you push on one of these bones, they are going to move. But this is an exception. The other thing is in infants and babies, there is this cavity or this part here that does not contain bone inside. We call it the fontanelle. I don't know if you ever, did you ever like carry a baby that's newborn? If you put your finger here, you will not find bone. Usually ladies try that. Don't try it. Don't try to push it, because believe it or not, it will go to the brain. There is no bone here. We call it the fontanelle. Synovial joints between the long bones, they allow us to move freely. Try any long bones, which are all these bones that I talked about. Humerus, and ulna, and radius, and the metacarpal bones, and the phalangeal bones, and the lower limb, same thing. They allow different types of movements, like you can bend, or you can straighten. We call it flexion and extension. You can rotate. There are different movements. You can do like this. You can move away. We call it abduction. We can move in. We call it adduction. You can move like your forearm like in, like this, pronation, and you can move it like this, supination. So there are a lot of different types of movements that's allowed for what? Synovial joint. Synovial joint between the long bones. Again, synovial joint, cartilaginous joint, fibrous joint. Synovial joints, all ends of long bones. Freely movable. There is cartilage at the end of the bone and fluid. Freely movable. End of a bone like ribs. And there is cartilage and then the sternum. Slightly movable. Another example, intervertebral disc. That cartilage disc, here is one vertebra, and here is another vertebra. In between, there is cartilage. So it is cartilaginous. What's attaching them is cartilage, or in between them, slightly movable. The last one, if there is a bone and another bone and fibrous tissue in between, like the skull, not movable. If it is movable, this is the one that we're focusing on, which is synovial joints. There are different types of movements. There are different types of synovial joints depending on how it looks like, but this is like too much details for us. Can look like any one of those, kind of too much. Can be like a hinge or a ball and socket, like ball in a socket here, but this is kind of too much. You can read it if you want to, but you will know all these details in more advanced courses. The joint attach or connect bone to bone because it's in between two bones. In all joints, what type of tissue? Connective tissue, filling the gap. Which joint is freely movable joint? Synovial. Which one have cartilage and slightly movable? Cartilaginous. Which one does not allow movement and it made of fibrous tissues? Fibrous joint. The soft spot in the baby, head that I told you, you can touch, if you touch it, there is no bone inside. It's called what? Fontanelles. Fontanelles. And that's it. This is a summary, again, repeating all what we talked about. Um, so I just want to remind you that you do need to know the names of the individual bones. Okay, otherwise you will be losing points. Okay, like this: ilium or coxa, femur, tibia, ulna, tarsal, metatarsal, phalangeal. There is this kneecap right here that's called patella. This is also a bone. So individual bones, you have to know it. Okay, all of these: clavicle, sternum, scapula, humerus, ulna, radius, carpal, metacarpal, pharyngeal. Again, don't think that this is too much because I'm just asking you to know just the whole bone. What do you call the whole bone? This is like, this is a car, this is a bike, just like that. But in the next course, this is definitely not enough. You will see. There will be like greater trochanter and lesser trochanter and a groove and a lot of details. For now, I just want you to know the name of the entire bone, and that's it. Good enough for this class. Okay. So this is what I want you guys to know, and we're done here. And I'm going to stop recording.